Hello, I'm here to demonstrate IV insertion. I have Jan as my assistant. Okay, so my very first step that I'm going to do is explain to the client who has been in a long labor. She's feeling dehydrated, she's been vomiting a lot, so we've decided collectively that an IV would help her along. So she has agreed to that. So I've put out all of my equipment. The very first thing I do is pick up the bag and take a look and make note and make sure that the expiration date is within dates. It is, and then I look actually at the fluid and it doesn't look funky. There's no particulate in the fluid, so it looks good. So I can get started with that. So I'm going to take my IV, which this was on that, remove the cap. I'm going to spike the bag. I'm going to turn it upside down, fill the chamber halfway. This is closed so that we do not go all over the place quite yet. And I'm just going to start to fill the tubing and flush the tubing. So we undo this and open this up, and we watch the fluid run through it, which it is. This is our cap, and it has started to go through now. Okay, so we now close it, sorry. And then we are ready to go. So you can hold that for me. And the very next thing I'm going to do is wash and dry my hands, which I'm not really going to do because then it will take long to put on my gloves. So, thank you. Appreciate that. All right, so I'm going to put on my sterile gloves. All right, my next step thank you. My next step is to apply the tourniquet, which we've discovered is very strange on a banana. It doesn't quite,
especially with gloves, though,
go the same. I will then clean the area. So I am going to use the povidone. I can open povidone. There it is. I've got it. I guess technically, yeah, but that's okay. Going to clean the area, let it dry. In the interest of time, I am going to, I don't really want this all over our stuff here. So. Let it dry and then use the alcohol on top of that to kind of remove that, and then let it dry. Next is my needle. Take this and this, take that little piece off. I find the bevel and I go up. I'm going to put a little pressure on the tension on the skin, about 4 inches below the tourniquet. I'm going to insert the needle, a little pinch right under the skin there, and I'm going to look for flashback to make sure that I have gone into the vein. And I have, so then I'm going to go in ever so slightly more, tiny bit more, and then insert the catheter. And before I remove the needle, I'm going to remove the tourniquet, put pressure here so that I don't get blood everywhere, remove the needle, and take the flush, and I'm going to flush the site. I go in, flush, 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 and I'm going to note if there's any swelling or infiltrate, which is not. So And then I remove the flush and take the IV, which is hanging, and insert that. And I can let go because it's here and hold that a little tighter. Then I take this and I'm going to open it. I unclick and then open it and watch, set it to the drip rate that I would like. And so after I've done that, I'm going to assess again, make sure everything looks good, that it's dripping at the rate that I want, that there's no swelling going on. This will be hung, and then I finish it off with my Tagaderm, thank you, which will go right over the IV here. And then I take tape and a little bit of tubing here and do a little kind of loop, and I'll tape it. Let me, guess I should rip off the tape first, that's easier. Okay, and then this gives it some slack and still gives us access to the site. So we can just tape a little loop there, and then we have access to be able to flush. And that's it.
I don't think it can flow into the banana. That's why we're not
No, I
getting
know.
any flow here.